The scientific fact that you need to start with is 37% of children diagnosed with autism lose their diagnosis. Today, I'm going to walk you through what to do in the first 30 days after an autism diagnosis. Think of this as your roadmap, clear, empowering, and rooted in science. All right, step 1, take a breath and reclaim your power. So the first thing you need to do may surprise you, which is pause. Yes, pause. There may be urgency, yes, of course, but acting from a place of panic is not going to serve you or your child. So you've got to take a moment to breathe. Your child hasn't changed. Their diagnosis didn't add or remove anything. It simply gave a name to what you've already been noticing. You're still the same loving, resourceful parent, and your child is still their amazing, unique self. In fact, the best long-term outcomes happen when parents are informed, grounded, and hopeful, not frantic. So take time to gather yourself. You're about to become your child's strongest advocate. Hi, I'm Dr. Theresa Lyons. I'm a Yale University trained scientist and autism parent. And I teach parents like you the cutting-edge science of autism so that you can make the best decisions for your child based on quality information. Step 2 is really take time to truly understand what autism is actually. Not what it seems like on TikTok or what it is for one person or another. The scientific fact that you need to start with is 37% of children diagnosed with autism lose their diagnosis. So right now, your child might be having issues with communication, social interaction, sensory processing, and behavior. Autism shows up differently in every child, and that's why it's called a spectrum. So what autism isn't is it's not caused by bad parenting. It's not something that can be cured overnight with one quick fix. And it's not the end of the road diagnosis. It's not something that necessarily has to stay with your child for their entire life. 37% of children diagnosed with autism lose their diagnosis, meaning they go on to live a full, healthy, and happy life. They don't need extra supports in school. They don't need therapy, speech therapy, OT, all of that stuff. No, they lose their diagnosis. They have what's called an optimal outcome. Knowing this information matters because it will help you navigate around treatment options with more confidence. But you need to know the scientific fact that the latest research shows that 37% of children diagnosed with autism lose their diagnosis. In the scientific literature, autism is now being referred to as some having non-persistent autism. So autism isn't a lifelong diagnosis. Previously, the scientific literature has referred to those who had lost their diagnosis as having an optimal outcome. All these scientific terms mean the same thing: a happy and healthy child who no longer needs additional support in school or in life. So get ready to learn about things that you might not have ever thought about. Things like how food is grown, what exactly is in your food. So much about your life now will change for the better if you're open to it. The autism parenting journey is different for every parent. For me, I was so scared in the beginning. I definitely was crying. I was unsure of what to do. I was panicked. I was frantic. I was like, I'll just do anything. I'll just do anything. Like, what do I do? What do I do? And not knowing what to do and trying anything without much logic as to why, I was just like a leaf blowing in the wind. Just getting panicky and thinking, okay, yeah, what about that? What about that? What about that? As I learned the science, now I'm steady like an oak tree. All right, step 3, get organized. So within the first 30 days, right? We're talking 30 days here. Start gathering and organizing. You want to put together your child's medical records, the different evaluation reports that were used to make the diagnosis, any therapy recommendations, And you can start making appointments at school so you can get the IEP process started if you haven't already. You can make appointments with different specialists. A lot of times they're going to book many months in advance. So get the different appointments you think you will need, get them on the calendar, and then you could give yourself more time to do research. You also probably want to get a calendar or some type of notebook so you can track behavior patterns and take notes. That's something really important. So in those first 30 days, you're pausing, you're getting used to a different reality, and you're starting to plan. So you definitely want to start tracking behaviors so you know what it is you want to address. So this is exactly why we created the Navigating Autism Matrix, because there's so much information and it can be overwhelming to figure out what to focus on and when. I'll put the matrix up so you can see. There's 7 categories, and the matrix is a structured roadmap that really breaks down all the autism science that you need to know. And it helps you stay organized and helps you stay on track on what you're focusing on and see where your child is thriving, and also where more support might be needed. You need a way to stay clear-headed, because as the weeks go on, you're going to hear conflicting advice. But remember, you do not want opinions. You want scientific facts, and you want to make the decisions based upon those facts. Now, you may start to talk to different autism experts, and more than likely, you will start to know more about autism than many doctors. And that's okay. Your notes and the matrix will help you make informed decisions, not reactive ones. Step 4. All right, this is towards the end, maybe 20 days in, 25 days in. Start to focus on 1 or 2 priorities. You took some notes. You got to see, okay, what are the most troubling behaviors relating to autism that is holding them back from living a full life? Or what is the number one thing that is really impacting quality time with the family? Start to get your focus of 1 or 2 priorities, not more than that. It's impossible to focus on 20 things at once, right? Pick 1 or 2. And I understand it feels like you have to do everything right away. So let's start ABA, let's get the supplements, let's get the speech. Just jump right in and do everything all at once. But trying to do it all at once leads to burnout, confusion as to what worked and what didn't. So instead, ask yourself, what matters the most right now? Get those priorities, 1 or 2 priorities. So for many families, it's something like communication and regulation. Can your child express basic wants? Are they able to stay regulated during the day? Start there. Start where it matters most for you. Build your foundation, and you can layer in more focuses later. Set your goal, achieve it, reassess, new goal, achieve it. You'll get that momentum, and off you're going. Step 5, build your team and filter out the noise. Autism care is a team sport. You cannot do this just by yourself. Start thinking about your support team. Who does that include? So a developmental pediatrician, definitely get an appointment for that if you haven't already. A neurologist, definitely get that appointment on the books. Functional medicine doctor. This gets a little tricky because they're expensive and most insurance doesn't pay for them. A lot of times it's best to do different functional medicine tests to really understand what the root causes for some of these behaviors are, and then get a functional medicine doctor appointment. But you can certainly start researching as to who's local, where would you travel to. So functional medicine is going to be a key aspect in your journey, so definitely start learning about it now. You might also want to start chiropractic care. You might start adding skilled therapists like speech, OT, PT, but you also might want to wait a little bit so that you conserve your energy. You also might want to get a teacher or an aide who truly sees your child's strengths. You're going to need at least one of those at school. You need an ally at school, for sure. And yes, other parents who get it. But here's the catch. Not every professional understands the full picture. You'll need to learn to filter the noise, and there's going to be a lot of noise. Not every expert has the latest science, or even your child's best interest at heart. If you're looking for more support, I certainly invite you to explore the Navigating Autism platform. Click the link below to learn more information. We're here to help you turn the complexity of autism into clarity and help your child thrive. Step 6. All right, remember, there is hope. And this part is crucial. You need to hear this. 37% of children diagnosed with autism will go on to lose that diagnosis and live a full and happy life. Now, that doesn't mean they were never autistic. It means they made progress. Many kids go on to make friends and play sports and thrive in school without extra supports. The key is early, informed intervention and parents who do not give up. They may get tired, they may take a pause for a moment or two, but they do not give up, ever. And you do not need to believe in a miracle. You just need to believe in science, effort, and possibility. So over the next 30 days, the most powerful thing you can do is stay present, stay curious, and stay connected. For those of you who have already been through the diagnosis process, what was the most helpful thing someone told you or did for you in those early days? Your insight could be exactly what another parent needs to hear right now. Thank you for watching, and remember, knowledge is power. Stay informed, stay empowered. See you soon.